So, as we all know, we are all managers. Me, I have never taken anyone not to be a manager. We are all managers, but it takes on how are we going to be managers, eh? How do you take yourself to be a manager? Kwanza, from the time you leave from your house, you are a manager, and then you come up to the facility, you are a manager. And many people misundertake management and leadership, so it becomes another crucial definition altogether. So people will consider how best do we link up management, governance, and policy agendas to manage wherever we are, or to manage institutions, or to manage how we are. Yes, we have policies, yes, we have managers, and yes, we have governance. So how do we link about all these areas? So to develop an effective management, governance, and policy agenda, actually it's very crucial and important for nurses and midwives. So this agenda should focus on promoting high quality care, ensuring patient safety, advancing professional development, and advocating for the well-being of healthcare providers. So, and I would bring out first of all what you mean by governance and what you mean by leadership, which has always been taught in leadership classes. What we mean by, oh, it has been projected. What we mean by management has always come, but you know, governance precedes quite a lot because it's a body that brings out everything together. So the key points to consider when creating such agenda, we have leadership and governance, where we, okay, it has come. So, so we have, I'll be very fast, please. Oh, Sinikate. So leadership and governance, we really need to establish strong leadership at all levels for nursing and midwifery practice, for frontline staff and executive leadership. So we need to develop transparency and accountability. For us to be seen to manage and to lead, there are many strategies that we can be great leaders. There are many ways we can be great leaders. Don't wait at daktari amesema ama administrator amesema, you are also a leader. Just be strategic wherever you are. When you are strategic, people respect you. Example is our ministry. We didn't have nursing anywhere, everybody saw. But under the ground and strategically, we have been given a division. So this is what I mean. You are a leader by yourself. I didn't open my mouth so loud, you didn't know what I did, but it is there. How did it come? You have to use strategies. See ati unafinywa, smile with everybody, but know what you need to do, okay? Yes, so I'm teaching you how to become good managers and governance, and how we need to link up all these things. Siko ubaya, sinawapenda tu. Alafu sasa, so we talked of leadership, and now we also need to check into the workforce development, and so development and implementation comprehensively orients and continuous education programs to enhance the skills and competence of nursing and midwifery. So in the workforce, we need to invest in career advancement opportunities such as specific specialized certification and the rest. You know, if we enhance our workforce, because we have had so many issues of migrations and shortage and the rest, I don't want to repeat, I know you'll ask me questions, but we need to foster a supportive work environment that values diversity, equity, and inclusion, and address issues of burnout and stress. So, as I said, you need to be strategists. You also need to look into how best can I manage my workforce, okay? And you people are all managers, as I said, and you are controlling a number of people. How best will I manage my workforce? It's the strategy that gives you the upper arm to manage, okay? So also the area of patient-centered care, we have policy advocacy. I'm trying just to rush in to see how best we can harness. So policy advocacy, you collaborate with governance, with government agencies and healthcare organizations to influence health policies that support nursing and midwifery practice. Just the way I told you, for us to have come with a policy, it took us to get into the political will. Otherwise, hatungekuwa nayo. and we had to justify as to why nursing alone. We have physiotherapists, clinical officers, we have doctors. Why nursing? So you stand firm. That's why I said you have to be strategic and give facts that make sense. We have gone global, but it was being diminished. So now we have come up, and it just comes by proxy. For example, at the World Health Assembly, there was a question on nursing and midwifery, and Madam had to answer it, our minister. So I had to do a write-up. On Monday this week, I was called again. We have the regional for WHO at Botswana, 73rd Regional Assembly. And the first question is to address achievement of nursing and midwifery. I was called. Now you see, by proxy. So as it comes, and I ask you, so what do you think we should do as Kenya to be seen as nurses and midwifery? Politely, strategically, and you come to the radar. Okay? So you need, I'm just teaching you bad, good manners. Although this is how we manage, you don't fight, but you are strategic and you manage. Yes, so advocacy for health equity, and we also have to bring in advocacy for health equity. We address health disparities and promote equitable access to healthcare services for underserved population. So we advocate for policies that reduce barriers to care, improve health literacy, and that is why we are where we are today. And then we also have data collection and analysis, which I also have emphasized so much. We also need a data dashboard, and Cambry has come in so strongly, and it is also one of the asks for WHO that we need our own the dashboard. And we are working so closely also with the Nursing Council. We need where I just press a button. I'll tell you I have 30,000 nurses in the private sector. I press a button, I know 300 have left the system through this proxy. This is what we are talking about, the data dashboard. And these are the things that inclusivity make the management, leadership, and the governance agenda together. So in conclusion, we need to create a comprehensive management, governance, and policy agenda which requires collaboration among nurses and midwives, leaders, policymakers, educators, and other stakeholders. By addressing these key areas, we can drive positive change, elevate the status of nursing and midwifery profession, and ultimately enhance the quality of healthcare services for all. For us, we have an alliance, Nurses and Midwives Alliance, which you need to know more. It's an alliance that has really created a lot of shake. As much as it is silent, it's very vibrant. We have the pod management, where we have all the nurse leaders who are there, and I believe they reach out to you. Kama wafiki uniambie, si ni kweli?